Hello and welcome to Happy Cells and Souls. My name is Julie Powers and I'm a licensed Zumba instructor and I'm a business partner with the Juice Plus company. My mission in life is to help people understand that life is better when they're dancing through it and to inspire healthy living around the world. But my expanded mission is to create better health at the cellular level and more joy at the cellular level. We only get one body while we're here, so we have to take care of it. And we're supposed to be happy while we're here and joyful and put all kinds of love and light into the world. Now, one of the things that I am so blessed by is that I have met some amazing people through my life. And I believe that every single person has a story to share and something that we can learn from them. Doesn't matter what our backgrounds are, if we're different views in politics, religion, if we come from different social, economic levels in life, if our cultures are different, we can learn from everyone. We just have to have open hearts and open minds. And today we get to learn from Kim Krusinski. And Kim is one of those people that just has a huge heart and all kinds of love and energy flowing out of her. And she is on a mission to help people live their lives and to continue living their lives, especially whenever they have someone that they love in a medical issue. Cardiac specifically is what you deal with, cardiac patients. But Kim, you're a registered nurse. You've been dealing with cardiac patients for 20 plus years. And you are also a patient advocate, a certified patient advocate, which I think for a lot of people, they're not going to know what that really means. So I would love for you to help explain what that is and if somebody is looking for help like that, because a lot of us have aging parents and other family members that we get caught in this cycle of needing to help them, and there's only so much of us to go around, right? So
Exactly.
tell us what you do, what this is, and how it can help.
Okay. So a patient advocate is essentially a guide, an interpreter, an organizer, a secretary. We do everything for you, whether it's you are the person who is having cardiac issues or you have a family member or a loved one or friend that you care about that needs help. So that can consist of attending doctor's visits, interpreting diagnoses, treatments, researching plans for you or options. We don't give advice. We help advocate for you to make your own decisions, for you to be aware of your rights, your options. And I hate to say it, but one of the positives of COVID was that we have now embraced this virtual world for all ages. And so patient advocates like me, we are able to help people no matter where they are. Remote areas really need a lot of help oftentimes because you don't have the resources right there. But basically the reason that I got into this, Julie, is because everybody needs help when they're on this healthcare journey, and cardiac is so emotional. And as you said, we are squeezed as children of parents who need help or friends. We don't have enough time or knowledge really to be able to be everything for everybody. And my real goal is for people to just be able to be that daughter or that son or that friend and really be able to fill that role. And I take care of all the medical stuff.
Right, right. And so you are based in Colorado, but as you said, because everything is virtual now, you can assist people in other states.
Correct.
I know that one of the things that you talked about was you don't just do patient advocacy, but you do kind of this healthcare coordination. You help people get things organized, but you also do billing reviews to help people understand the bills that they're getting and their explanation of benefits from their insurance companies. And that can just be, mind blowing for people. And it's hard enough to get better when you have a heart problem or if you are trying to help someone along their path, getting rehabbed or whatever the need is. But when you start getting into all the billing issues and does this match up and was this really what we had done? Having someone like you with your knowledge is really helpful.
Yeah. Yeah, and I mean, it's so sad for me when it's heartbreaking for me, really, when I have someone. I work in a hospital as well. When I have a patient there that is so worried about what their medical bills are going to be, what's going to be covered, what's not, that they can't even think about healing or treating what their medical issue is. And so that's what I can help with as well.
Right, right. Well, I know, from personal experience, I've had people in my family who have had pretty extreme chronic health conditions that I've, been a caregiver, and I've also been, daughter,
Mhm.
when my parents have gone through different things. And like you said, you're allowing the siblings, the daughter, the son, the parent, whoever the family member is that's trying to help, be the family member and not have to worry about all the business side of things. And I know that something as simple as just making appointments sometimes can be very challenging for people because you might have to be on hold forever, and then you don't know if the doctor is the right doctor that you need to see, and is this the right specialist, and what are they going to want to do? And since you've been a cardiac nurse for so long, you can explain, well, what does it mean when they do a heart cath? Let's talk
Yes.
about that, because a lot of people, when they're in the doctor's office and the doctor or the surgeon is telling them what's happening, it's all so fast, and they shut down, right?
Right.
So you're able to pick up the pieces afterwards. Can you tell us about that? Is it usually a face to face? Is it a Zoom? Is it a phone call? How does that work for you?
Well, it can work according to patient preference. So if it's a local patient, for example, then what we can do, we plan ahead. So we can plan ahead for, oh, okay, we know that you can expect this appointment to take about this much time, or this procedure to take about this much time. Will you likely spend the night in the hospital? What can you expect? We plan ahead so that we know the primary concerns and questions that my patient, my client has.
Mm-hmm.
That when we go into the initial appointment, we know what our goals are, what our questions are. And so healthcare providers actually really benefit quite a bit from having a patient advocate there with their patient. And then it also opens up that room for, oh, in case the person starts to get overwhelmed or panicky about all the information, we have our basic, this is what we wanted to know. And then also I provide support and the background knowledge to address any new questions that might come up while the physician is speaking, because anyone in the healthcare profession, not only do you have so much more limited time now to spend
Right,
with patients, but also you tend to forget the language that you're using is not something that someone understands.
right,
And so
right.
that is a big part of what I provide as well, is that sort of interpretation, making sure you understand and making sure we ask the questions to address your concerns and that we're doing something that you actually want to do.
Because a lot of healthcare professionals, like you said, they forget that people don't have the vocabulary, and the patient doesn't want to look stupid.
That's true. Very true.
They're like, oh, I should know what that is. I've heard that on a TV show before, or and like they don't want to say, I don't know what that means. Or maybe the patient sort of knows what it is, but the family member wouldn't know what it is, and they're like, wait a minute, what is that? I've heard that that's
Right.
really scary, and that's that could be really dangerous or
Exactly.
whatever. And just having someone like you walk through the steps would take a huge burden off of them, by having that available.
That's right. One of my goals is to be there for people who don't have their family members in the area, or family members that have any background in medical knowledge at all. Um,
Mhm.
so that I can communicate. I mean, I do that as a nurse at the hospital as well. We sort of communicate with the patient's family members. The patient says, here, talk to my daughter. The doctor just told me this, but I don't know. She's asking questions I don't know the answers to.
Right.
And so we can kind of coordinate, communicate with everyone that the patient wants to have information. And that takes the burden off either the patient or the patient's family member that they would designate to communicate with everyone.
Now, so are there specific forms then that are signed so that you have like HIPAA authorization to, discuss a patient's care on their behalf? What are the logistics of that?
Exactly. And that, I mean, everyone has signed those forms if they've ever been to any kind of healthcare provider, but there are specific forms that you can allow family members or whoever you designate to allow them to have permission for the doctor or medical people to give them information. And I'm a big proponent of that. That's something I do with every client, that in our initial meeting where we're setting up our care plans, is that who can we provide information to? Who do you allow to have information? And I recommend that for anybody that's going, that has a physician or is going, especially in the hospital, because as you know, healthcare providers are not allowed to provide any kind of health information to anyone without specific written consent.
Right. Yeah, it gets tricky because I know I hear an echo right now. I'm not sure what's happening with my video, but anyway, I hope you don't hear it.
No.
Anyway, I know that my husband and I just recently did like some estate planning, and we're trying to get all of our ducks in a row for financial power of attorney and healthcare power of attorney and healthcare directives, for end of life issue kind of thing.
Good for you.
But it's really a lot to think about. And a lot of people, especially younger people, they don't have those things. And, I've talked to my son even, who's 24 years old, and I'm like, hey, it would be a really good idea for you to have this, because we cannot legally get information. If you're injured in a car accident, they'll ask us for permission because we're next of kin, but there are certain things that they don't have to share with us. But if it's going to help your care, somebody needs to be designated, whether that's us or, whoever you choose. But that's a completely different role than what you guys do, because you're not making decisions for the patient. You are just providing all the information and education.
Exactly. Clarity and helping organize things and finding resources for people.
Very good. I know you've been doing this for a while. Are there any stories that, I mean, obviously you can't share people's names, but like situations that you'd like to share that would show someone how this works in a real life scenario?
The biggest thing that comes to mind for me is, and this has happened with quite a few people actually, but so it's more general, but the anxiety and the fears that come with any kind of cardiac issue. Of course, it's not specific to cardiac that you can have fears with any diagnosis, but that really hits to the heart of people, and no pun intended. And so, so when someone is so scared, anxious, worried, it interferes with them even being able to think clearly, absorb information, make decisions. And so my presence and the relationship that we build, which can be built fairly quickly, especially in emergency type situations, relieves that worry, that fear, that unknown, that I don't know what to do. I don't know anything about this. And that is the biggest blessing, because that allows the person to just really be there, whether it's the patient,
right,
their family, and generally it's all one unit. You can't take care of one person without the other, because they are so, closely involved and emotionally involved. And that really is the biggest blessing to me, is knowing that I give them that sense of peace, reassurance, trust, consistency, one consistent person, because as you know, in any kind of healthcare situation, the more complicated or serious it is, the more complicated and spread out and fragmented, and the number of people involved is, someone needs to really be the one on the ball and allowing for that consistent communication.
Right. I think that it is a brilliant business model for the future, because as you know, as families tend to not live with one another, a lot of other
Exactly.
cultures, every generation fills one home. And you have the little kids and you have the elders of the family all living together, and everybody's part of that. And so there's a huge support system. In the United States, we're so broken apart into our little family units. And a lot of times we don't live near our other family members, and there is no family support. So something like this would be the answer to a lot of people's prayers. Now, your company is called Heartology, Heart, Heartology Patient Advocacy. But there are probably patient advocate groups across the country that people can look at. But you have a broad spectrum of clientele in the cardiac units, right?
Yes, yes. There is a national database of board certified patient advocates. It's a fairly new certification that it's been around, I believe, less than 5 years, the certification per se. But there are patient advocates that have been doing this quite a long time because they had the heart for it, whether they were in a medical situation where they would have benefited from someone helping, and so they learned the need for it. Nurses, doctors, social workers, a lot of us in the healthcare profession have obviously seen the need for it, and so some people all around the country are doing that as their full-time profession now.
Right. Which is just, I'm just so happy that there are people out there that can do this. Are there any specific areas that you would like to make sure that people know about if they're going to contact an organization? Are there any specific questions that they need to ask?
Definitely. There are most patient advocates are private. There are patient advocates that work for facilities, hospitals, that sort of thing, but of course they are really working for the facility. And so to customize and have the patient have all of the goals of care and plan of action be specific to the client, you need to have a private patient advocate. And really the main thing I would look at is reviews of the patient advocate. Everyone that I'm aware of offers free initial consultation so that you can get to know if it really is a match, because even just personality wise, whether it's a match for the family, for the patient, and their experience level and their background.
Okay.
Yes, you just need to be aware and make sure it's someone that's trustworthy.
And right now, is patient advocacy something that can be billed to insurance, or is it just a private pay service that people pay out of pocket until it becomes part of the standard of care?
Right. For the most part, it's private pay out of pocket. On some occasions, there are some services that can be billed depending on what kind of insurance or Medicare or Medicaid. But for the most part, you need to go into it expecting it to be private pay. And I will say that for the most part as well, especially with reviewing bills or avoiding excess tests, heartache, time delays in care, it really is well worth the money spent.
Sure. Well, sure, because if you're reviewing the bills and you see that there was a mistake that needs to be addressed, it could be for hundreds and hundreds of dollars, sometimes thousands of dollars.
Right. And that is a big fight for people that have to take on their own.
Right. And
if they are even aware of it. Yeah. And I mean, medical billing errors they're estimates, but generally believed to be 80% of bills have medical errors in them.
Yeah. And if you don't know what to look for, then
Exactly.
you're just lost. So
Right.
yeah. And a lot of times people are afraid to question it,
True.
and it depends on their level of comfort with the medical system. So I just want to thank you for doing this for people and being that person for so many families that can ease their minds and let them live their lives and continue living their lives instead of worrying about all these details, and helping, letting somebody else help them through that. So thank you.
My pleasure, Julie. My pleasure.
Thank you for sharing the story.
My pleasure.